what we found is that those individuals that have higher baseline dopamine have higher working memory capacity. You can train working memory capacity. You can build it up by taking dopaminergic drugs. You can increase working capacity. So it is valuable. And on the other side, if you're stressed, if you're sleep deprived, if you have low dopamine, just naturally, you will lower your working memory capacity.
Collective Insights is a voyage through topics and technologies revolutionizing human well-being. Groundbreaking approaches for a better world and a better life await you. Welcome to Collective Insights.
Hi, this is Dr. Greg Kelly, VP of Product Development at Qualia and Doctor of Naturopathic Medicine. Did you know roughly 50% of people are deficient in magnesium? That's concerning because magnesium is one of the most vital minerals to human health, supporting brain health, healthy aging, bone health, heart health, metabolism, sleep, and more. But getting enough magnesium from our diet can be challenging. Allow me to introduce you to our new formula, Qualia Magnesium Plus. Qualia Magnesium Plus combines 9 forms of magnesium, along with 70 minerals and trace minerals that support magnesium actually being retained and used well in the body. With this approach, Qualia Magnesium Plus raises the bar on magnesium supplementation. At Qualia, we formulate products we want to take, and I invite you to experience the benefits we're seeing for ourselves. Go to qualialife.com/magnesium and enter code magnesium at checkout for an additional 15% off your order. That's qualialife.com/magnesium with code magnesium. Enjoy today's episode. Hi, this is Dr. Greg Kelly, and today we have Dr. Mark D'Esposito, a distinguished professor in neuroscience and psychology at the University of California, Berkeley. He's earned his medical degree from the SUNY Health Science Center at Syracuse and trained in neurology at Boston University Medical Center. He investigates the neural mechanisms underlying cognition and how the brain recovers from injury. He has over 430 research publications cited over 80,000 times, has written and edited 7 books, and has received numerous competitive NIH and private foundational research grants. He's trained over 80 graduate students and postdoctoral fellows and served as the president of the Society for Behavioral and Cognitive Neurology, chairman of the International Society for the Human Brain Mapping, and the editor-in-chief of the Journal of Cognitive Neurosciences. He was elected to the American Association for the Advancement of Science and the American Academy of Art and Sciences and received the Fred Kavli Distinguished Career Contributions Award from the Cognitive Neuroscience Society. So listeners, I'm sure you can get from that impressive bio that we have a really distinguished and knowledgeable person about the brain today. So welcome to the show, Dr. D'Esposito.
Thank you for inviting me.
Oh, it's our pleasure to have you. We always love talking about the brain and learning more from brilliant people like yourself. So can we maybe start? I know I read one of your publications. I can't remember the title, but it was you as the sole author and talked really about your journey. And I think it started, when your undergraduate days and then interwove some of the things we'll talk about. So I found that fascinating and would love if you could just share a little bit about your journey with our listeners.
Sure. Well, I think one way to sum up my journey is I'm really a testament to Steve Jobs' idea that you can't connect the dots forward, you can only connect them backwards. And that's something I certainly keep telling my kids. So if I look back, the journey, each stop makes sense. But if I look forward, I don't think I ever would have predicted where I've got. I was actually the first one in my family to go to college. When I got to college, I wanted to be a doctor for no really good reason except just something to set my goals high and make my mother happy. And then picking a major was also something that was just serendipitous. We were the first, at the University of Rochester, we were the first neuroscience major in the country. I thought that was fascinating because there weren't even textbooks at the time. And the first course I took was something called The Shattered Mind. Howard Gardner wrote this book. He was a psychologist, and he spent spent the whole year at the Boston VA hospital seeing patients with aphasias and amnesias and agnosias and then described them. And that was just incredibly fascinating to me. And flash forward many years later, I went to medical school. I became a neurologist, and I actually went to the Boston VA to do my training. And of all the different specialties in neurology, cognitive neurology or understanding sort of how the mind works was most interesting to me. So I had planned on being a clinical neurologist, but then because there was so much unknown about it, it just seemed like I couldn't practice it without also studying it. And I went on and did some training to try and learn how to use patients with brain damage to try and understand the normal mind and how to help people. Then right at that time, functional MRI appeared. This was a sort of a incredible tool that allowed us to look at the healthy brain and see how the brain works while you're thinking. And so I became a assistant professor at the University of Pennsylvania and was able to use that tool to study healthy undergraduates, which didn't make a lot of sense to my neurology colleagues, but I was trying to do both things, to try and map out the normal healthy brain and then study the damaged brain to try and understand both how the normal brain works and then what we may be able to do with the damaged brain. That's where I am today. I'm a neurologist, I'm a cognitive neuroscientist, and spend a lot of time also as a professor.
Wow. Well, thanks for filling us in. I think we could have spent the whole 45 minutes just you telling us all the different steps along the way. So one of the things I know when I was looking at things that you've spoken about, that are articles that you've published, is areas that I know I'm interested in called cognitive control and executive function. So could you explain a little bit about what those are to the listeners, and then maybe talk about how those show up in our life?
Sure. I really got into the study of cognitive control through seeing patients with frontal lobe damage. In fact, the talk you alluded to was a tell about the frontal lobes as told by neurologists, because it all starts there. I saw these patients at the Boston VA that had this, very severe damage to the frontal lobes. And the way they behave in the real world was fascinating, and just wasn't clear why they were acting the way they were. And we give them tests and they seemed seemingly normal sort of at the bedside. But then when you see how they behaved in the real world, there was something wrong in terms of faulty decision-making and how they planned out their lives and how their kind of real world intelligence. And I realized what I learned was that their inability was thought to be an inability in cognitive control. The clinicians use the term executive function. Cognitive neuroscientists use this term cognitive control. It means the same thing. And it's really the highest level cognitive ability. It allows us to kind of guide our behavior, based on our goals and based on our intentions and based on rules. It's rather than sort of behaving automatically based on whatever's going around with us. So in essence, it's what makes us human for sure, and is considered one of the highest abilities. So it allows us to organize, to plan, to set priorities, to monitor behavior, allows us to be flexible and adaptable. And I think we can all understand how important this is for real life, and why patients with damage to the frontal lobes that would cause these kind of deficits would have trouble in just sort of simple, day-to-day activities.
I know kind of my default is this is more a story than actual neuroscience, but I tend to think of certain things the brain does as almost on a hierarchical pyramid. And I tend to think of executive functions as near the top of it. And often, if our cognitive load is challenging in other areas, it seems like executive function will suffer. So I guess I'm saying that is like one of the things that seems to be true in people I've worked with, or when I've tried to do some working memory testing, is that I've often described stress as an example of kryptonite for executive function. Would that be true? And if so, are there other diet, lifestyle, or situational things that your research has led you to believe really can impact executive function or cognitive control?
Yeah, so first let me answer the question about hierarchy. Absolutely, the brain is hierarchically organized. There's a top and there's a bottom, and the top does influence the bottom. So as information is coming into our senses, we can't control that. But we can control what we pay attention to and what we ignore. And we call that top-down control. And that's what the prefrontal cortex does. When information comes in and you have to attend to something relevant and ignore something irrelevant, you need your frontal lobes to do that. And when patients or people have difficulty with cognitive control, they let irrelevant information in. Not only that, but they don't sort of follow the goal that they had set out for themselves and get distracted. And so in daily life, we get bombarded, and there's a limit to our capacity to control our behavior. But we do a pretty good job if we've got healthy frontal lobes. But when things like stress or sleep deprivation, or if you got a cold, all of these things, poor nutrition will dampen sort of frontal lobe function, and that's the first thing that's going to get hit. In any sort of complex system, the most complicated part of the system is going to fail first. And so I think of it in that way, that these sort of stressors on the frontal lobes that lead to these faulty sort of behaviors just normally. I mean, if I was to just wake you up in the middle of the night, or you don't get good sleep that day, we all will have problems with cognitive control. Not to the extent that a patient with frontal lobe damage has, but to some extent that's noticeable.
Well, and I think of emotional self-regulation. Would that be part of executive function, or it's more social cognition, or bleeding into both?
Yeah, absolutely. I mean, the frontal lobes is a big place, and there's a portion of the frontal lobes that is important for cognitive control, and then there's another portion of the frontal lobes that are important for emotion regulation. And these two areas are talking to each other and influencing each other. So sort of cognitive control will influence our emotions. We'll dampen down emotions when they need to be, when we need to make an important decision, and not let emotion sometimes get in the way. But on the other hand, emotions will also sort of influence our decision making when it's important to use the context of emotion. And those are they are two areas of the frontal lobes that are talking to each other.
Okay, great. And I'm asking that just because, again, this would be more one of Dr. Greg's stories. But my dad was an executive, worked eventually as a president for a big engineering company, long commute. Growing up, we were on eggshells, so to speak, at the end of the day when he would get home, because you didn't quite know if he was going to be the grouchy, irritable dad. If given an opportunity to recharge, which was often, polishing his shoes and tinkering at his workbench, then the grouchy, irritable person was replaced by normal dad. And my story has been just that my dad used up his cognitive resources over the course of the day, commuting, and he kind of tapped out all the executive functions that he had and needed to replenish his brain a little bit by relaxation. I don't know if that would be accurate-ish or completely off the rails.
No, I think you're exactly right. We have our resources, especially our resources for cognitive control, are not limitless. We have a limited capacity. And we will push up against that capacity, and we'll go above that. When we go above that capacity, we start to break down. So recharging is a great way to look at it. It's really difficult in today's world to sort of get this point across. I mean, when I was at the University of Pennsylvania, I had about a 25-minute walk home, and that was exactly what I needed to sort of recharge. On the few times when I would drive in, for some reason, it only took 5 minutes to get home. I was still, like your dad, I was still revved up by the time I got home. So absolutely, that kind of cool down is especially true. But I think you can even broaden it. A few years ago, I just decided that I was going to stop looking at emails after 6 o'clock at night. I just made a cutoff, and I realized that nothing happened. Between 6 o'clock the next morning that I couldn't deal with the next day. And that was another way of cool down, sort of limiting the number of texts I take in. I think we've sort of just driven to go above our capacity all the time. And we've got to think of ways to let our capacity get back to normal.
I know trying to be generous, spirited to people, if someone isn't showing up as their best self, my default story is, they've probably used up all their cognitive resources and that's why they're behaving this way, instead of making a character judgment. Because I know myself, if I'm sleep deprived or stressed, I won't be necessarily the person I strive to be.
Yeah, I think most of the time that explains human behavior. I mean, as a parent, I know with my son, when he was in high school, he was cranky. He was either tired or hungry. I mean, it wasn't that complicated. It was things that were sort of pushing him. Certainly, there's other things that come up in life that make that stress out teenagers, things that will. But that most of the time that was it. So I think those are things we can control. And so I think those are simple things that we can control when we're trying to have a so-called normal life.
Great. Well, and I wanted to now dive into something else you've written a lot about that I think of as a subset of cognitive control, and that's working memory. So can you share a little bit about your work with that?
Yeah, well, working memory, you can think of it as sort of one of the processes, cognitive abilities that fall under this very broad term of cognitive control. There's many different types of memory. We mostly think about long-term memory, our ability to learn new information and recall from the past. That's one type of memory that seems to be very dependent on the hippocampus in the brain. But the other type of memory, working memory, or some clinicians like to call it short-term memory, is what's dependent on the frontal lobes. And this is this kind of online memory, our ability to sort of temporarily hold on to information that's not there. So if someone tells you their telephone number and you have to hold it in mind and put it into your phone, that's working memory. Or even if you're filling out a form and you have to call up your social security number and hold that in mind while you're typing it in. This is sort of this online memory. It's really a building block for all of cognition. We can't have this conversation unless you hold in mind the beginning of the sentence until I get to the end. So we're constantly sort of keeping information active so that we can we can use it and manipulate it and move forward. So I think a working memory is sort of a building block. In order to have good cognitive control, in order to be able to take in what's relevant and damp out what's not relevant, you have to hold in mind what the goal is. So if the goal is, pay attention to the road or turn when you get to exit 22, you have to hold that in mind in order to exert good cognitive control. So it's part of the same system and very dependent on the frontal lobes.
And is there, I'm fairly certain of this, but there's a pretty broad range of capacity that different people have. And some of the same things you mentioned with like sleep and stress can impact working memory. Would that be correct?
It is correct. I mean, there's just normal variation of working memory span of how many bits of information you can hold in line. There's quite a variability. We're all pretty similar. I mean, there's a reason why, telephone numbers were 7 and that they were chunked in a way, 3 and then 4, because we can all hold about 4 items in mind. That's pretty universal. Some can do more and some do less. What's interesting about it is that seems to be dependent on how much dopamine you have in your brain. Dopamine is a chemical that's made by a natural chemical made by the brain. And what we found is that those individuals that have higher baseline dopamine have higher working memory capacity. You can train working memory capacity. You can build it up by taking dopaminergic drugs. You can increase working capacity. So it is malleable. And on the other side, if you're stressed, if you're sleep deprived, if you have low dopamine, just naturally, you will lower your working memory capacity.
I hadn't realized there was that dopamine connection to it until preparing for this episode and looking at some of the work you've published. So I know our audience hears dopamine mentioned in many different contexts, but I thought that was really fascinating.
Yeah, I can say a little bit more. I think that we hear mostly about dopamine and reward and addiction. There's different dopaminergic systems in the brain. Certainly, there's one system of dopamine that's important for reward and pleasure and things like that. But there's another dopamine system that's important for cognitive control. And that's the dopamine system that I'm talking about. And it turns out that there's an enzyme in the brain and the frontal lobes that clears out dopamine and then allows it to be reused again. And some individuals have a gene that makes this enzyme either too active or not active. So quite a large number of healthy individuals, either have sort of above normal or below normal sort of dopamine. So some of the individuals that are just born with sort of lower dopamine levels have a lower working memory capacity because of that. And you can boost it with increasing dopamine. But it's one thing I should point out, it's very important. Dopamine has this function in the brain that's U-shaped, meaning that there's an optimal amount. So if you have too much dopamine, you actually can impair working memory. So it's not, more is just not better, at least with the dopaminergic system. It's optimal dose.
Yeah, I think that Goldilocks principle applies to so many things. And culturally, we tend to be a more is better default. A lot of things with physiology, that's just not how it plays out.
Right. And so that's why it's going to be important for us to, as we move towards personalized medicine, to know and define what each person's neurochemistry is, so that we can get to their optimum neurochemistry, because we may push someone over to too much in one certain neurotransmitter, and others we will push towards optimal.
Now, with really focusing on the dopamine connection to working memory, with say like a teenager, how might that manifest if they were, say, low dopamine versus high dopamine with working memory, or like what a parent might see in their behaviors?
Yeah, well, I mean, I think working memory capacity is very predictive of academic achievement, as predictive of reading comprehension. The higher working memory capacity you have plays out as beneficial for a wide range of cognitive abilities. So being on the lower state, that could, that is one of the sort of factors that contribute to the kind of achievement that we see in school. The hard part is that we don't have a way of measuring dopamine in the blood system. If we could measure it easily and then know, we can start to try and supplement those individuals that have lower dopamine. And I'm sure that would be beneficial for academic achievement.
Great. Well, one of the things I think I've seen you mention in a podcast I saw you on was that it may also be important to focus on more than one of these neurotransmitter systems to get the best cognitive process. And I'll use that maybe as a lead-in to kind of the modular design or architecture of the brain, because that looks like it's been a big area of your more recent research.
Yeah, I think we, even though have talked about the frontal lobes as one area of the brain. It's part of a network. And the frontal lobes are connected to almost every other part of the brain, and almost every other part of the brain is sending information to the frontal lobe. So it's in this incredibly privileged position. And it turns out that the brain is made up of many different networks, frontal networks being one of those. And all of this term connectome is like the genome is meant to kind of refer to all of the connections in the brain. And the brain is incredibly connected. I mean, if you connected every computer there and device in the world, there still wouldn't be as many connections as there are in your own head. But what's been fascinating about looking at the networks of the brain is that they're very similar to all the networks we have in the world. They're similar to the electrical grid. They're similar to airport networks. They're similar to social networks. They act very similar in how they function. So I've used the example of the airplane networks many times to try and explain how the brain works. There's basically a network of regions, and some regions are more important than others. The regions in the brain, airplane networks that are important are called hubs. And so Chicago is a very important hub. So if that hub gets affected, it affects the whole system. And so I give you the example, if you're flying from New York to San Francisco, even though you're not going through Chicago, if Chicago's having trouble, you may have a problem. Whereas if there is a smaller regional hub like Milwaukee and they're having a problem, you will notice it. So if you think about the frontal lobes as being a very important hub, like Chicago, if having damage to that or stressing it or putting it beyond its capacity will affect the whole system, the whole brain as a whole, not just a very, one specific ability.
If I'm correct in having listened to you speak before, so say there is some frontal lobe trauma or some trauma somewhere in the brain, if a hub happens to be hit, it's much more impactful than if some non-hub area of the brain was what took the lesion or the damage or the stress.
Yes, because the hubs in the brain are the most metabolically active. They're in the most demand. They need the most blood flow and glucose and oxygen. So they're like Chicago. They're using a lot more resources than the rest of the brain. So when we are stressed or sleep deprived or poor nutrition, the hubs tend to take the hit first, and so that they're going to be affected. And what's exciting about thinking about how we can sort of improve or optimize brain functions is that the brain is incredibly plastic. It can change at any age. And so how do we reroute networks? How do we go through, another hub as we're trying to get from San Francisco to New York? We might go through Houston. They're the same thing. The brain can do the same thing. And how can we develop therapies that allow for this sort of network reconfiguration when a hub is stressed or damaged?
I know you mentioned fMRIs, but can maybe talk a little bit about how neuroscientists like you would view or see this, in a scan, this modular architecture?
Sure. It turns out that it's actually quite easy. Functional MRI, even though it was discovered quite many years ago, is the tool that looks at the activity of the brain instead of the structure of the brain. And so it's very powerful in terms of looking at how networks are organized and how brain regions are connected to each other. So with fMRI, it just uses a regular clinical scanner, and you only have to scan an individual for about 5 minutes. They just simply send the scanner and they rest, so they don't perform any cognitive activity, and we collect these scans over time. And then by sort of very sophisticated analytical tools, we're able to sort of define the connections in the brain and identify the hubs and identify how strong these connections are in each individual. So we don't need to take a group of individuals to get this information. We can tell you how modular your brain is versus another.
I've seen different lists of, some of the major networks and some maybe minor. Is there any consensus about, what several of these networks would be?
Yeah, I mean, it's interesting. When this was first discovered that we could identify these networks with fMRI, it turned out that there wasn't an infinite number of networks. There seemed to be these same 6, 7, 8 networks that appeared over and over again. So there is an unlimited number of networks that control the brain. And there's been a lot of work trying to understand what each of these networks do. And they've been given names like the default mode network, or the frontal parietal network. And there's a lot of work trying to identify their function. But what I think, which is more important than identifying the function of each of these networks, is understanding how they interact with each other, because it's really that interaction that's leading to human behavior. How integrated they are and how well they communicate leads to good or bad behavior. And so modularity is this reflection that doesn't depend on knowing what the networks do. It's just trying to understand if the brain is communicating, if these networks are communicating or not communicating. And so those who have more modular brains, these networks are more sort of distinct. And sort of how modular your brain is very predictive of a whole host of things. We've shown that you can measure how modular brain is and predict if someone is going to respond to cognitive therapy. So, for example, if you give cognitive therapy to traumatic brain injury patients, those with more modular brains will more likely respond. You can look at patients who are in a coma, and those who have higher modularity are more likely to have a positive outcome after a year. You can look at older adults and show that higher modularity patients have less decline. So there's something about measuring sort of what your baseline modularity is for understanding, not only how you're going to age, but sort of how you're going to respond to these interventions.
Wow, that's fascinating. Have you been able to, or have other researchers identified, certain, I guess, say whether it's dietary behaviors or other things that seem to track with having a more modular brain?
Yeah, I mean, I think modularity as a biomarker is becoming very popular because, as I said, it's a very simple thing to do. I mean, it's not simple to get a scan, but it's just a 5-minute scan. And now there's a number of studies sort of looking at the potential of this as a biomarker. So there are studies for everything that you can imagine. I know we were participating in one study with exercise and showed that exercise can improve executive function as much as cognitive therapy can. And again, sort of the modularity predicted how well exercise was going to be beneficial. So I expect when we do nutritional studies, it's going to be similar. It's going to be able to sort of track and predict sort of the response. And that's what we need. We need any intervention to improve brain health. We need to be able to measure that brain health is actually improving. Otherwise, it's going to be very hard to sort of know what to recommend.
Do you have a sense of how much time that you'd want between, say, an intervention and when you remeasure it to see if it was working?
I mean, it depends. We've done studies where as little as a month of training is enough to make a prediction. Other studies are 6 months. I guess it all just depends on the intervention. But the tool is powerful enough to predict within minutes. I mean, we can predict within a task. If someone is doing a task during the scanner, we can predict based on their modularity if they're going to get the subsequent response correct or not. We can tell if they're going to be right or wrong within seconds. So it's from the technology point of view, we're able to do it on a very quick time scale.
Wow. And are there many universities or places in the United States doing this kind of work, or is it still fairly novel and just a small subset of you?
I think almost every major research university has now fMRI, and then many other clinical academic centers have fMRI as well. So it's becoming popular. So collecting getting the images is fairly easy. The more difficult part is the sort of analyzing the data. So there are less places that are able to sort of take the MRI data, turn it into a modularity metric. But that's something that's easily solvable. And if it becomes clinically useful, it'll be easily scaled up to any center anywhere.
And I guess now going a little bit into what you would have done for interventions, are there any technologies or behaviors that you are intervening with and measuring changes?
Yeah, I mean, in terms of, the kind of interventions, in terms of improving the cognitive ability, it kind of falls into two types. There's the therapist-driven, human-driven sort of interventions, and then there's ones driven by technology. One of my former trainees, Adam Ghazali, has developed sort of an amazing set of tools that use digital games to improve executive function. And one of them was approved by the FDA to improve the cognitive control deficits in ADHD. And I think that's going to be an incredibly powerful way to scale it up and to have patients actually engage in it. And so the potential for that type of approach is great. There's other type of training, one that I've used a lot called goal management training, which is developed at the University of Toronto, which is more driven by therapists, where you need a human being to sort of help with the training. This is a method where you learn this extensive sort of strategies for improving sort of complicated tasks. So you learn things. develop projects like, planning a meal or planning a family reunion, and then you learn sort of all the strategies that go into achieving that goal, like how to break the project into subtasks and how to create a timeline and how to, maintain what's relevant and discard what's irrelevant, how to keep your eye on the ball, and, how to monitor your progress and get around roadblocks. So those things need a human being to help with teaching. That's a teaching skill. And that kind of intervention is incredibly powerful and successful in improving executive functions. So I think there's going to be there's a lot of different ways, and it all just and different levels of effort to sort of get there. But there are other things, like I said, exercise alone, almost any type of exercise can improve executive function as well.
I know that sometimes when I think of exercise, like I know often with like a high level athlete, they'll become even more focused. Their attentional networks presumably are active, among other things, as they're engaged. And then other people, the way they would describe their exercises, they're more zoned out, right? They're going through the motions. I'm sure that would look very different, from a modular architecture point on the brain. But would your intuition be that one of those may be better or worse for improving executive function?
Yeah. When we started doing goal management training with our traumatic brain injury patients and also elderly that were having some cognitive difficulty, we added a mindfulness approach as well to the training. And it's been shown now over and over again that when you add mindfulness to these types of cognitive therapy, they work better. So, part of the overlying theme throughout when a therapist is trying to teach all of these high-level strategies, like how to break things into subtasks, they have to keep being reminded to stop, relax, and refocus. And that's mindfulness, right? This has to be embedded in the task, embedded in it. Otherwise, individuals get overwhelmed. So my intuition is, that those that are able to control their physiology, these strategies will work better. And I know with for an effort in human performance is trying to control our physiology. And that's another thing we can do. We can measure sort of heart rate and respiratory rate and physiological parameters and try to use those as a biomarker along with modularity to figure out how to optimize these interventions.
When I know this would be in Dr. Gregg's brain hierarchy with executive function on the top, I've often thought we need attention to get to executive function. If we're not paying attention, then, obviously these higher capacities of the brain are going to be less likely to be things that are working for us. And I generally think paying attention or mindfulness is the gateway to almost anything important.
Absolutely. One of the things that frontal lobe patients will do is that they'll know the goal that they're trying to achieve, but then they just get distracted and don't achieve it, right? They're told to do something, go down and get a loaf of bread and come back, and then they get distracted because they're not keeping in mind and paying attention to it. So they completely go hand in hand. It's fascinating that the knowledge of what they're supposed to do is not a problem. It's achieving it. And you're right, attention ability is incredibly important in this equation.
The brain's, as you mentioned, so plastic and often learns through feedback of some sort. Are there any things that fall more into that feedback loop world that you've worked with for frontal lobe patients or with any of these areas that you've researched?
Yeah, I think one of the observations by neurologists of frontal lobe patients is that they don't monitor their progress very well. They don't have a lot of insight into their deficits, and so they don't self-monitor. So they don't really adjust to the mistakes they make or the roadblocks. So that's definitely an avenue for training, which is very different from the other kind of cognitive, strategies that we have. So the monitoring part, I think, has to be sort of built in. I think when you do therapist-based training, there's probably not enough reps in terms of, trying to help people improve monitoring. But within digital technology, you can get feedback over and over and over again, and that feedback can scale up to being really to a sort of level that is actually starting to make a difference.
One of the things, I think it might have been the author of Livewire, that neuroscientist, but that the story, as I'm recalling it would be that in World War II in England, when they were trying to spot the German planes coming over, that they recruited bird watchers. And what they found is that some bird watchers were really good at identifying German planes and some weren't. So the good ones, they tried to get them to explain what they were doing so that they could teach it to new people. And that didn't work. But what eventually did work is just having new people make a guess, like, oh, that one looks like a UK plane to me, that one's German, and then just giving them feedback. And eventually the brain on its own learns how to become more proficient. So that feedback piece, I think almost in any area that someone's struggling, if we can improve feedback, I think often, we're at least on the right journey to helping that person improve in their life.
Yeah, I mean, absolutely agree. I mean, it's been known for learning and for memory that making errors, that you learn from your errors, and the feedback's incredibly important. So yeah, I think that any kind of training has to do that. It also sort of reminds me that the goal of this training is for it to generalize. When you're done with the goal management training, it's not successful if you've only learned to do the projects that you did in the goal management training, like make a meal or plan a family reunion. That has to generalize to life. And so that's what's been a problem with some of the trainings out there, is that they're very hyper specific. You can, you can learn how to recognize birds, and then you can't recognize sort of planes. So whatever it is that they did, they were able to tap into how to generalize it as an ability that will translate. And that's the goal. And what we find with goal manager training is it does generalize, and people feel like, yeah, this is just helping me in a lot of things I do in life, not just the things I learned while I was doing the training.
This analogy may not be correct, but like thinking in terms of exercise, right? We can train for something really specifically, or we can train to be, more fit, for lack of a better way to describe it. And if we're more fit, then that generalizes to, often many other forms of activity.
Yeah, and absolutely right. And I think that's one, as people search for how to improve, brain health or improve executive function, it doesn't have to be something specific. It has to, it's not going to be something that the same for everyone. It has to be something that's meaningful to you and something that you like, or you won't sort of do it. But I think there are lots of different ways to get to the same goal with different types of intervention. There's lots of different ways, as you know, to exercise. There's lots of different ways to boost executive function, whether it's learning a new skill or reading, dense history, nonfiction books, whatever it is. There's different ways. There's going to be different ways to get to the same outcome.
Great. And then two other areas I wanted to just touch on briefly would be smartphones, I think is something I've heard you mention, and then the way aging might be connected to some of these areas that you've been researching.
Yeah, I'll start with aging. So that's the easier one. I think that as we age, again, just as I was talking about how the one system in the brain, the frontal lobes, is the most metabolically demanding. And so that when we stress it in any way, that's the first system to sort of take a hit. That's also true with healthy aging. As we get older, as the brain is affected, the frontal lobes seem to be more affected than other parts. The hippocampus is another area. So the frontal lobes and the hippocampus, they just seem to be healthy. So when you look at sort of abilities that change over time, those abilities attributable to frontal lobes and hippocampus are affected more than others. But there are parts of the brain where abilities improve. I mean, certainly we become more wise as we age, our vocabulary gets bigger as we age. So it's not true that every part of the brain is affected in the same way with healthy aging, but the frontal lobes do. And that's why we had done goal managing with healthy elderly, because they felt, they just experienced objectively that they're sort of how fast they process information, how well they multitask, how well they sort of organize plan is dropped the notch. And that was, the brain was plastic enough to benefit, to benefit from this training. But on the technology use, I'm not an expert in this area, but I'm surely a parent and have seen it, even with my colleagues. It's like what you said earlier. It's another stressor to the system. It's another thing that's stressing the capacity of our controls, our cognitive control system. It is doing it in a way that's amplified. I mean, there's a hard day of work is a big stressor, but the amount of stress that goes into just an hour of watching, on Instagram. I just heard in the news that Instagram is going to have a different type of account for teenagers, and they're going to limit it to an hour. And so certainly limiting the amount of time is one approach, but moving towards schools not allowing cell phones at all is probably another approach that's going to be effective, because it's just competing with what our brains need to do.
Yeah, and I often think of vicious cycles and virtuous loops. And I know if my brain was already exhausted and then I engage social media, I'm much more of an X person, the old Twitter, than any other social media, but that's not recharging for my brain. And then, it's easy when I'm already worn down then to default to things that'll actually wear me down more. Like the cognitive control is already tapped out for the day in a sense.
Yeah, and I think, I've read some studies where have compared sort of using phones, by searching webs and looking at TikTok or whatever for an hour versus just doing other things that are mentally fatiguing. And it's not just simply fatigue. It's really something about tying up these specific cognitive control resources by the type of things we do on our phone. And that's much worse, that's even worse than being fatigued, because now you're taking out a very complicated system that needs to be at its optimum, and it's not.
Yeah. I mean, if we want to eat well and actually go to bed on time and do healthy things, we need that system to have its resources freed up, not overwhelmed.
Exactly.
Great. And before we go, I wanted to just have you mention your work in the Brain Health Project and how listeners could follow you and find out more about the incredible work that you're doing.
Yeah, I'd really like to promote the Brain Health Project, which is at the University of Texas, Dallas, and you can go to their website to see it. But it's really a landmark project that's aimed to sort of study and measure and track one's, brain fitness. And it's analogous to the Framingham Heart Study, which started in the 40s and tracked about 5,000 people in the community. Almost everything we know about cardiac health, that we've got a lower cholesterol and lower blood pressure, came from simple observation of this town over time. So it's very much analogous to that the idea is to enroll up to 100,000 people in this project. I think there's already over 30,000 and across all the states and 60 countries. And when you enroll in it, you will be able to take a measurement called the Brain Health Index, which allows you to assess your own brain's fitness. And so part of the goal is to develop a Brain Health Index, since we don't have one. When you go to your family doctor, they don't have an index of your brain health. They're able to assess every other organ in your body, but your brain, because there isn't the tool available. And what's neat about the Brain Health Index is not just studying your cognition, but studying also things about your daily life, exercise and nutrition, and your well-being, like mood or purpose or quality of life, or your interactions like social support or social engagement. So it's a very comprehensive measurement, which you will get if you enroll. And then you can enroll in training if you'd like. This is something called SMART training, and there's actually coaches that are involved. And then you'll take your index again in 6 months, and you can keep going every 6 months to see how your brain health sort of changes, and also learn about ways to sort of improve your brain health. So I think it's a wonderful thing for everyone. I think for a scientist, my goal is, one, to come out of this to try and develop what is the best way to measure brain health, so that we can have a measurement for everyone to use for whatever type of intervention they want to try, and also sort of develop some of the best sort of ways of actually improving brain health.
Great. So is it brainhealthproject.com?
The best place to go is at the University of Texas, Dallas Center for Brain Health. You type in the Center for Brain Health, UT Dallas. That is the home of the Brain Health Project.
Great. Well, thank you so much for being with us today, Dr. D'Esposito. Do you have any other parting words or comments before we close out the interview?
No, thank you so much for inviting me. It's really exciting that there's so much interest, in brain health. As we've moved from fitness, has taken the lead for a long time, and now we're into brain fitness, which is just fantastic that everyone's so engaged.
Well, thank you again.
Okay, you're welcome.
This podcast is for informational purposes only. The podcast is not intended as a substitute for professional medical advice, diagnosis, or treatment. You should not use the information on the podcast for diagnosing or treating a health problem or disease, or prescribing any medication or other treatment. Always seek the advice of your physician or other qualified health provider before taking any medication or nutritional, herbal, or homeopathic supplement, and with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this or any other podcast. Reliance on the podcast is solely at your own risk. Information provided on the podcast does not create a doctor-patient relationship between you and any of the health professionals affiliated with our podcast. Information and statements regarding dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guests' qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to therein. If you think you have a medical problem, consult a licensed physician.